Dilation or biodegradable stent placement for recurrent benign esophageal strictures, a randomized controlled trial. Introduction. Benign esophageal strictures, BES, occur following peptic, corrosive, or radiation injury, surgical anastomosis, postmucosal resection, or esophageal inflammatory disease. Dysphagia is a frequent symptom for these patients, resulting in an inability to eat a normal diet and leading to malnutrition, weight loss, aspiration, and impaired quality of life. The primary treatment for BES is endoscopic dilation with balloon or bougie dilators. Although dilation relieves dysphagia in the majority of patients with BES, repeated sessions, which are a burden to patients and increase healthcare costs, are frequently required. Temporary stent placement, which dilates the stricture for a prolonged period of time and may lead to a reduction in stricture recurrence, is a potential treatment for patients with strictures that are refractory to ongoing dilation. Partially and fully covered self-expandable stents require additional endoscopic procedures for removal and are prone to tissue ingrowth or migration. To address these problems, biodegradable stents have been designed as a promising alternative. To reduce the risk of migration, the biodegradable stent has flared ends and is uncovered, allowing for tissue ingrowth. Stent integrity and radial force are typically maintained for up to 8 weeks, and considerable stent degradation is expected approximately 12 weeks following placement. A recent study reported a median time to complete stent degradation of 127 days, range 98 to 219 days. Because the biodegradable stent degrades, removal is not required. Experience with biodegradable stents is limited to small case series of patients with refractory strictures. No studies have evaluated whether biodegradable stents placed earlier in the treatment algorithm could be an effective alternative to reduce the risk of recurrent dysphagia. This study compared the efficacy and safety of standard dilation and biodegradable stent placement in patients with recurrent BES. Background. Dilation is the standard of care for recurrent benign esophageal strictures, BES. Biodegradable stents may prolong the effect of dilation and reduce recurrences. Efficacy and safety of dilation and biodegradable stent placement early in the treatment algorithm of recurrent BES were compared. Methods. This multi-center randomized study enrolled patients with BES treated with previous dilations to greater than or equal to 16 millimeters. The primary endpoint was number of repeat endoscopic dilations for recurrent stricture within 3 and 6 months. Secondary outcomes through 12 months included safety, time to first dilation for recurrent stricture, dysphagia, and level of activity. Results. At 3 months, the biodegradable stent group, N equal 32, underwent significantly fewer endoscopic dilations for recurrent stricture compared with the dilation group, N equal 34, p less than 0.001. By 6 months, the groups were similar. The number of patients experiencing adverse events was similar between the groups. 2 patients in the biodegradable stent group died after developing tracheoesophageal fistulas at 95 and 96 days post-placement. No deaths were attributed to the stent. Median time to first dilation of recurrent stricture for the biodegradable stent group was significantly longer, 106 versus 41.5 days, p equals 0.003. Dysphagia scores improved for both groups. Patients in the biodegradable stent group had a significantly higher level of activity through 12 months, p less than 0.001. Conclusions. Biodegradable stent placement is associated with temporary reduction in number of repeat dilations and prolonged time to recurrent dysphagia compared with dilation. Additional studies are needed to better define the exact role of biodegradable stent placement to treat recurrent BES.